There are several conditions that can develop after prostate cancer therapy, including erectile function as well as urinary incontinence problems. So we typically see patients who had their treatment done for cancer, and we address those issues, whether it's erectile as well as urinary incontinence issues. Seeing this men's health specialist who specialize in treating ED as well as in incontinence is essential in obtaining best outcomes, because specialists like myself can provide you with the latest and greatest technologies and cutting-edge treatment that can be helpful and more influential and effective to treating your condition. Depending on the type of prostate cancer therapy, that could impact the erectile function and urinary incontinence. Typically, patients who undergo radiation or radical surgical removal of the prostate can have impact on the erectile as well as urinary incontinence. However, some other forms of therapies, like focal therapy, has lesser impact on erectile function or urinary incontinence. So it depends on the type of the treatment for cancer. Again, depending on the type of modality of treatment for prostate cancer, oftentimes men present with something called stress urinary incontinence, which is a leakage of urine under stress. When they're laughing, coughing, sneezing, they have a drop or two of urine that can be very bothersome to them. The good news is that there are some options for that and some treatment options for that and can be very effective, such as the male sling or even more advanced treatment. Typically, patients after prostate cancer therapy, they recover within the next coming months after surgery. We often see them in the pre-operative and also post-operative time. We provide them with some pills, medication, counseling, education to help them through this journey of recovery. Within next coming months, we expect recovery of the urinary as well as erectile function after therapy of cancer. There are several important tasks that we ask you to do, such as Kegel exercises or pelvic floor physical therapy that can be done before, even after surgery for cancer, that allow you to regain strength of the pelvic floor muscles and reducing the amount of leakage during the time or the time of the day or even night. We also, regarding your erectile function, we ask you to obtain erections if you can with the pills or even without the pills to encourage the blood flow to the penile area, and that will has its benefit in the long run. There are a number of good options for erectile dysfunction, ranging from pills to injections, vacuum erectile devices, as well as penile implant that can be providing a more definite treatment for erectile dysfunction. There are several options for incontinence, such as penile clamps, that also the male sling, that is a procedure that allows us to place a sling around the urethra to lift up the bladder. Also, there are more advanced therapies that can be also discussed with your specialist. We encourage our patients to really enhance erectile function at all times, because that will maintain blood flow and oxygenation of the penile tissue that will allow it to have normal erections, and then hence allowing the penile length to maintain. There are also devices like penile traction devices that can be used, or even the vacuum erectile devices that can be used before and after surgery to allow the penile to maintain its length. After cancer therapy, obviously you need to focus on either recovering well from the surgery or radiation therapy, maintaining healthy lifestyle, regular exercises, maintaining a healthy erectile function, as well as urinary control function is essential for you in the long run.